Many older adults take aspirin every single day, but new guidance shows that they don't need to do that.
Our 9 News Health expert, Dr. Payal Kohli, is here. And, why is it that so many adults think that they need to take aspirin?
Well, it's funny. It's a phenomenon left over from the 1990s.
Yes.
We did a ton of research that said an aspirin a day keeps the doctor away, because at that time we had very few drugs in our armamentarium to prevent heart attacks and strokes. So it really did work. But more recent guidance in 2019, the American College of Cardiology said we should infrequently be using aspirin for people that have not already had a heart attack. These are people we call primary prevention. If you've had a heart attack or stroke, it's a whole different story. You definitely need that aspirin, and I want to be clear about that. But if you haven't, you may not necessarily benefit. You may actually be doing harm, increasing your risk of bleeding. And what we see is that almost a third of adults over the age of 60 are taking an aspirin a day to prevent heart attacks and strokes.
So like that baby aspirin thing is what you hear about. So
Yes.
the people that make aspirin are probably not eager to share this.
Well, and it's funny because we call it new recommendations, but these are actually recommendations since 2019. In 2022, the U.S. Preventive Services Task Force also said sort of the same thing, but human behavior hasn't caught up because we haven't advertised the fact that most of us who haven't had a heart attack and stroke don't need an aspirin a day to keep the doctor away. Now, I will say before you stop an aspirin, if you are taking it, you have to check with your doctor because there could be some other reason you might be taking it. But for many of us, this is really raising the question of what we're doing more harm than good, because we know aspirin thins your blood. Aspirin can increase your risk of bleeding ulcer, life-threatening bleeding, and we also know that the other medicines that we're doing, the cholesterol medicines, the blood pressure, the blood sugar, are doing far more than just the aspirin to prevent heart attacks and strokes.
So for someone who's taking an aspirin a day, like you said, there are some tips and guidelines maybe to follow if they, want to get off of that routine. What other tips and guidance do you have?
So heart attack or stroke, stent, do not stop your aspirin. You will cause a life-threatening complication. And in fact, when these updated guidelines came out, there was a period where the cardiologists and the neurologists were sitting with bated breath because we would keep getting patients in the hospital who saw on the news that they're supposed to stop their aspirin. So don't stop your aspirin if you've been asked to take an aspirin because you've had a heart attack or stroke or heart disease. And in general, if you're on one, make sure you talk to your doctor before stopping it. But on the other hand, if you're not on one and think you might benefit, that's the conversation to have with your doctor, because there are a subset of people who have not yet had a heart attack or stroke who are going to benefit. So this is not a one-size-fits-all, and that's the message here. We really have to customize based on your risk, based on your heart, based on your family history, your risk of bleeding versus your risk of heart attack and stroke, whether a little aspirin makes sense for you every day.
So if you're doing it right now, you don't really know, continue it. But then, is this something I could just send a message in the portal, or do I have to go in to see a doctor?
It's a great question. No, you can send a message in the portal. So this doesn't necessarily have to be a long, prolonged discussion. Can I stop my aspirin? And you'll get a yes or a no. If you're going to start, it's a little bit more of a nuanced discussion because there's risks and benefits. So they've done these randomized trials in older people. They've done randomized trials in diabetics. And so, the amount of benefit you get, does it equal the risk? Those types of things. If you're an Eliquis or another blood thinner, usually combining with aspirin is a bad idea. If you've had a history of bleeding, like a bleeding ulcer, certainly you don't then want to take an aspirin
that's
either.
dangerous too.
And a lot of people take aspirin just for feeling good. My muscles feel better because I have less back pain. But remember here, we're talking about a blood thinner, especially if you're taking the higher dose, which has no more cardiovascular benefit and increases your risk of bleeding compared to the baby aspirin. So I don't want us to think about aspirin as a benign medicine. I certainly don't want everyone to think that it's a aspirin a day keeps the doctor away. I want us to be really thoughtful and really careful and personalize our treatment plan to decide whether aspirin makes sense.
Okay. They do say that if you put an aspirin, crumble it up in your flowers, your fresh flowers, they last longer. So maybe that's what you could do with
well, that's interesting to know.
I have no proof beyond this, so don't go to me for anything. I just heard that. I'm trying to think of what to do with it.
So as a cardiologist, I'm writing a lot of aspirin for patients who have positive calcium scores.
Oh.
So if you get an X-ray of your heart, it's got a little calcium deposits. That means you have cholesterol deposits. You benefit from aspirin. But I'll start telling them to put some in their garden too.
I don't know. Who knows? No idea. All right. Thank you, Dr. Kohli. We appreciate it.